take your medicine. On today's show, we will be discussing the role of a pharmacist. I decided to do today's show because a lot of people ask questions about what exactly does a pharmacist do. We've been called glorified shopkeepers, which I think is unfair. I think we are highly trained drug therapists. So today I'm going to give you an example of something that would occur normally in a pharmacy, which is a patient coming in, handing in a prescription, and then seeing it from a different point of view, in that normally a patient would come in, they would hand in their prescription, wait a few minutes, get the medication, get told how to use the medication, and then they're gone. So I guess maybe people misinterpret this as we just packing medication away, but not really understanding what we're actually doing as soon as the prescription enters our hand. So today I'm going to take you through a prescription. Obviously the names are not there, but it's an example of what we do. So here is a prescription that I've been handed. So as you would see, it has the diagnosis, the description of the medication, and the quantity of the medication that's been prescribed. So under the diagnosis you have these lettering and numbering. So each one represents an ICD-10 code. Now the code actually tells us what's been treated. So in this case, there's 3 different codes. So there's 3 different illnesses that's been treated. Number 1, the first one, it's the code J01.4, which actually means acute pansinusitis. So obviously somebody's got an infection of the sinus. The next one is J30.4, which means allergic rhinitis unspecified, which shows that the person has a running nose. And the last one is B35.4, which is tinea corporis, which is a fungal infection on the skin. So let's go through each item. So the first item is beta-prednisone, 5 milligrams. Prednisone is a steroid and it's used to treat inflamed sinuses. So it actually helps to bring the swelling down in the sinus area, thereby reducing the inflammation, thereby reducing the amount of mucus produced. The dose here is 4 tablets, be 20 milligram a day. Now, my recommendation to the patient would be to take it after meals, as prednisone can cause ulcers. So that's why I would explain to the patient to take 4 tablets after eating, once a day for 5 days. The next medication is Elozad 20 milligram cream. Elozad contains both a steroid and an antifungal. The cream, the dosage is to apply twice a day for 14 days. The hydrocortisone cream is to reduce the inflammation and the itchiness. It stops the itching. And the miconazole is actually used to kill the infection, which is the fungus. The next item is Microcycle 500 milligram. So Microcycle is an antifungal tablet. You'll be taking it orally, and this is used to kill the fungal infection on the skin systemically, which means through the blood. The dosage is 1 tablet daily for 30 days. My recommendation would be to tell the patient to take 1 at night, because this tablet can cause a bad headache, and also to take it after eating at night, and with a glass of milk. So with the milk you get better absorption, and I found with patients in practice they actually get less headaches when using it at night. The next item is Flowmust, which is a nasal spray. The drug in it is fluticasone propionate, which is a steroid, and it's used for 30 days. The dose is 1 spray per nostril twice a day. You'd use it for 30 days. It's a steroid used for inflammation in the nose and in the nasal cavity. So this would help reduce the sinus, and it's used on a long-term basis, which is 30 days in this case. The next item, Cataflam D, which is diclofenac, which is an anti-inflammatory. The dose is 1 3 times a day when needed. That's what PRN stands for. My recommendation would be to take it after meals, because anti-inflammatory tablets cause ulceration. So always have a big meal, then take the tablet. The next item would be Spectropain, which is a pain capsule. It contains 2 drugs, paracetamol and codeine, and they are both used for treating pain. The dose is 2 capsules 3 times a day for 5 days. PRN, again, when needed. The next item is Zytrogen, which contains the drug Cythromycin. So this is an antibiotic. It's used to treat the infection in the sinus. The dose is 1 tablet daily for 3 days. My recommendation, again, 1 tablet at night, since this can cause a headache in the sun. And also I would give it an hour before eating, because one of the main side effects is nausea and vomiting. Use it for 3 days, complete the course. The last item on the script is Polentine 10 milligram. Polentine contains the drug loratadine 10 milligrams, which is an antihistamine, It's a long-term antihistamine, long-acting antihistamine, so it's used for the whole month. As you can see, the dose is 1 tablet once a day for 30 days. After evaluating the script, I have to make sure there's no drug interactions. Make sure to tell the patient that to use it at the correct times, like either before or after eating, or ensure there's no cross-drug interactions between the medication. But one of the important things I found with this patient is that when asked about the history, the patient told me they don't have any allergies to any of the medication, but the patient is a chronic asthmatic. Now, the drug Spectropain contains paracetamol and codeine. Codeine we do not use in asthmatic patients as it can cause respiratory depression, meaning they will battle to breathe. I asked the patient, if they had informed the doctor about this. The patient had not. So I contacted the doctor, informed the doctor that the patient is asthmatic. I would not recommend the codeine being used. And doctor agreed. We actually taken that item off this prescription. The patient, when questioned about if they had other pain medication, they did have paracetamol on its own. They said they'd use it 2-3 times a day. The doctor agreed with that. The patient continued with the medication. So now you guys can see, in the time you hand in your prescription to the time you've received your medication, this all happens within 30 seconds to a minute. We have to go through everything, check if everything's okay, process the medication on the computer, and then hand it over to the patient. Now, one thing that I do normally when handling a prescription, I normally take out the medication. So that's the first time I have a look to check that everything is exactly as the script says. The next thing is when labeling the medication. That's also, I read the dosage again to make sure the medication is correct. And then thirdly, when handing the medication over to the patient, I'll read the label again to the patient, informing them how to use the medication and explain to them the directions. So as you can see, there's 3 different times that I actually check the medication before actually handing it through to you. So after listening to this, I would like you guys to now comment in the comment section below and tell me, what do you think? Are we glorified shopkeepers or highly trained drug therapists? Don't forget to hit the like button and also subscribe to the channel. And I'd like to thank you guys again for joining me. Take care and goodbye.